Ladies and gentlemen, esteemed guests and fellow educators, good morning and welcome to board. We all know that children are very important, and why they are important because they take up very important roles when they grow up, and they are the future leaders and future workforce. And investing in their well-being is very important, especially investing in their education and health. And the prevalence of type 2 diabetes is increasing globally, we all know. And the major reasons are the childhood obesity, inactivity among the children, and their genetic predispositions. These are the basic reasons why children they are prone to type 2 diabetes. And the CBSE has raised concern about it in their recent circular that type 2 diabetes is increasing significantly. And the circular is Academic 26, dated May 14, 2025. And today's webinar is the timely initiative by Kanpur Surya schools so that we can sensitize our fellow principals and the stakeholders. And it will help us to understand the causes and precautions of type 2 diabetes. And it will be very fruitful to us. So, dear participants, I welcome you on board. I hope many fellow principals have joined and some might be joining. So we are starting this webinar expert talk as per the time given. We are delighted to have two special guests today, two experts with us, Dr. Anurag Bajpai and Ms. Anjali Chabra. They are with us today on this webinar to share their valuable insights on type 2 diabetes. So let's welcome Dr. Anurag Bajpai. We all know we are familiar with Dr. Anurag Bajpai ji. He is a very renowned pediatric and adolescence endocrinologist, and he is associate director endocrinology at Regency Healthcare, a very popular healthcare resource in Kanpur. And he is also president of Indian Society of Pediatric and Adolescence Endocrinology. Dear participants, Dr. Anurag is very popular and he is expert in this field, and he's helping many schools and children for their health issues. He's also running one society with the name of Grow India Society, and they are conducting very many seminars and sensitizing webinars for the teachers, parents, and the educators. Dr. Anurag has completed his undergraduate and postgraduate training at All India Institute of Medical Sciences in New Delhi. And later he worked as a fellow and a consultant in the Department of Endocrinology and Diabetes at the Royal Children's Hospital in Melbourne, Australia. And during this time, the Royal College of Physicians awarded him fellowship in endocrinology. So Dr. Bajpai brings extensive expertise in managing diabetes and such disorders in children and adolescents. Today, he will share valuable insights on the rising concern of type 2 diabetes among children, its causes, consequences, and practical remedies. So, on behalf of all the member schools of Kanpur Surya Schools Association, I welcome Dr. Anurag Bajpai. Welcome, sir. We have another special guest among us today, a lady with beauty and brain. Please join me in welcoming Ms. Anjali Chabra ji, Joint Secretary Academic CBSE. Ms. Chabra brings extensive experience and expertise in shaping academic policies and initiatives. We are honored to have her with us today to share her insights and perspectives on the important topic of type 2 diabetes among children. Welcome, ma'am. Welcome. Uh, dear participants, before we proceed with the expert talk of Dr. Anurag Bajpai, we would be honored and request Ms. Anjali Chabra, ma'am, Joint Secretary Academics, to share few opening remarks. Ma'am, your insights would set the context perfectly for our discussion on type 2 diabetes. So I request you to kindly share a few words. Thank you very much.
Good morning, namaskar to all the members present here of Kanpur Sahodaya, Dr. Balwinder, Dr. Bajpai, and I can see Ms. Shobha Das also. So I am no expert. At the outset, I would like to say I know nothing about type 2 diabetes, though diabetes run in the family. My paternal side, everybody is diabetic. All my chachas, my cousins, and my father also. So a little afraid of diabetes. So when Dr. Balwinder said that this is a webinar, so I thought let me also come here and know more about it. So all the expert talks I leave to Dr. Anurag Bajpai. CBSE has already issued a circular. I think it's a very, very welcome step. And today, when we have such a sedentary lifestyle, our children also, they don't move. I don't know how much our sports person, they initiate all the sports activity, but I don't know how many students follow that and take that home. In the school, of course, they are not on gadgets and all these things. But this intrusion of technology has taken toll on health, and I feel it's right time we take steps. And I think all the initiatives start from the school, क्योंकि जब छोटे भी हम थे तो we always see कि घर जाके ये मम्मी पापा की बात तो सुननी नहीं है, लेकिन हमारी मैडम ने ये कहा है ये ठीक है. So let's start it with madam only and sirs of course, and bring that idea home to children also, that it is very important to have an active lifestyle and it is for their own good. Unless they understand that, I don't think any preaching or any webinars or any posters or any circulars put out by CBSE will help. So children are smart enough today also, thanks to this I would say genetic progress. Children today and every generation, I believe, is smarter than the previous one. So we have very, very smart kids and we should rely on them. I always see we should believe in them, that they can understand what we are trying to put in their minds. So I request all the schools to find interesting ways to put this idea in their heads. If you are only preaching and telling them sugar nahi khana, ye nahi karna, and you all are having good time with all the pizzas and pastries and all, everything, they are not going to follow that. So we have to lead by example and create those fun activities in school also, where they can understand what happens. So my first introduction to diabetes, of course, as I shared, was in the family only, but in children I could never imagine unless I have a friend, very, very close friend, and I was in post graduation. She's a senior and she got married and she had a child, and that child developed diabetes at the age of 5. And that time I first time realized that children too are vulnerable to this kind of a disease, and we have to be very aware. And it's been, that child is now teaching in a school, and long time has passed, but we as an organization or any other organization, I have not seen, or the schools, I have not seen taking that to the schools, to children. So it's a very, very good initiative, and of course Kanpur Sahodaya leading and paving the way to take it through the webinars, and roping in Dr. Bajpai for this wonderful initiative. So my best wishes to all of you. I'll not take much of time. I know everybody must be very keen on hearing Dr. Bajpai rather than me, because I have no idea on diabetes, and this whole program is on diabetes. So all my best wishes to all of you, and may you always keep working towards good health of our children, because as they say, it's very cliche, health is wealth. Thank you, sir, for having me. And again, all the best to you all.
Yeah, thank you, ma'am. Thank you for joining the webinar. And truly said, primarily the reasons are inactivity among the children. They are not participating in the sports. They are more prone to technology and they have more, screen time. These are the reasons, and the lifestyle is also one of the reasons.
Sir, I am interrupting you for a while. You will be happy to see one more person who is actually behind this circular. I'll just move my screen and he'll say hello to you.
Hello, sir. Good morning. Dr. Manjeet Singh ji is with
He's
us.
Dr. Manjeet Singh.
Sir, namaskar, sir. Dr. Manjeet
So,
Singh.
sir is dealing with the academics as well as the sports
Sports.
of CBSE,
Um,
sports
Time में
department.
sports तो गल शुरू कर दी थी.
Sir, thank you, sir, and thank you, ma'am.
So, I
This
request
circular
Dr.
issued,
Manjeet
sir,
Singh ji to
ये
share
मेरा
few
ही circular
words.
था, sir. This is circular issued by the sports cell and the academic unit under the guidance of Dr. Pragya Singh. He's the director of academics from CBSE. एंड सर मैं 2 मिनट लूंगा, मैं बता दूंगा कि हमने सर्कुलर इशू क्यों किया है वाला. Because I'm heading the sports and the NCPCR and other NGOs and some doctors and parents, they are approaching seriously that the diabetes is being diagnosed in school children also. तो हमारे पास काफी रिपोर्ट्स आई, काफी मेल्स आई दैट सीबीएसई बहुत अच्छा काम तो कर रही है क्योंकि हम स्पोर्ट्स को प्रमोट कर रहे हैं, कंपटीशन कर रहे हैं, बट इट्स नॉट अबाउट ओनली कॉम्पिटिशंस. उसके पार्टिसिपेशन इंपॉर्टेंट है और उसके साथ साथ जो फिटनेस है वो हमारा गोल है. जितना थोड़े बच्चों में होता है, लेकिन जो फिटनेस है वो सब बच्चों की आती है. देन इसके बाद हमने काफी डिस्कशन के बाद डॉक्टर प्रज्ञा सिंह डायरेक्टर एकेडमिक्स, उन्होंने कहा कि हम सर्कुलर इशू करते हैं जिसमें हम स्कूल्स को हमारे पास जो स्टेक होल्डर मेन है वो स्कूल है कि वो स्कूल ही उसको इम्प्लीमेंट कर पाएंगे दैट बच्चों में फिटनेस लेकर आए. और इससे भी ज्यादा इंपॉर्टेंट है कि जैसे भी डॉक्टर अनुराग वाजपेयी बैठे हैं, ऐसे एक्सपर्ट्स जो है वो हमें बहुत जरूरत है कि वो स्कूल्स को, टीचर्स को, प्रिंसिपल्स को एंड बच्चों को गाइड कर पाए कि कैसे हमें इस डायबिटीज से बचना है. तो आई एम थैंकफुल टू डॉक्टर अनुराग वाजपेयी कि आप जैसे डॉक्टर हमारे साथ जुड़े और सीबीएसई काम और आसान हो जाएगा. एंड आई एम थैंकफुल टू कानपुर सहोदया कि जिन्होंने सर्कुलर पढ़ के सबसे पहले इनिशिएटिव लिया है कि आप सब सहोदया को, प्रिंसिपल को एक प्लेटफॉर्म लेके आए हैं. एंड ऑल द प्रिंसिपल जो आज ज्वाइन किए हैं उनको भी बहुत धन्यवाद मेरा कि हम ये इनिशिएटिव बहुत आगे लेकर जाएंगे. सर थैंक यू वेरी मच. सर मैं अब ज्यादा टाइम नहीं लूंगा, डॉक्टर अनुराग वाजपेयी आज बैठे हैं, उनको सुनिए. थैंक यू सर. थैंक यू.
Yeah, thank you very much, Dr. Manjeet Singh ji and Ma'am Anjali Chabra ji for
Sir, it's
sparing
called
time.
having a cake and icing too.
Yes, sir. But see, CBSE and the academic department of CBSE is always the torchbearer and the guide to us. So we always look towards CBSE academic department for guidance and education. So now it's time to finally start the expert talk, and the topic is also very interesting. When sugar becomes bitter, diabetes in children. So I request Dr. Anurag Bajpai to share his expert perspective on the topic. Please, sir.
Thanks a
Over
lot,
to you.
Dr. Balvinder. And first of all, I'd like to thank the entire Kanpur Sahodaya team for being involved with us with a lot of our activities in past and inviting us for this. Along with the entire team, Ms. Shobha Das, Dr. Ganti was there, and we were having a lot of interaction. And subsequently, also, we have been carrying for a lot of research work. A very special thanks to Ms. Anjali Chabra and the entire CBSE for bringing up this very, very important topic. And I, as president of ISPE, actually, I'm planning to do many more activities in terms of these, how to improve lifestyle. And this was one of the agenda. So this has already been taken up. So this is a wonderful initiative, and I hope this is going to go a long way in improving the health. Now, what I'll do today is to take a brief glimpse at really is the problem that we are facing currently, and also to showcase that these problems are just the tip of the iceberg. In the near future, we are going to face many more problems. Now, the topic is specifically being made about sugar becoming bitter. So sugar is a symbolism, so to speak, of high calorie food, which is not going to be of much benefit, but is going to do more harm. Now, why are we so much concerned about obesity? Now, if you go by any of the ancient cultures, including our own Indian culture, we always been thinking obesity is a good sort of a thing. It's often been considered to be a sign of prosperity. So this is the depiction of Kuber, who is supposed to be the god of wealth. And really, you can see the obesity. Our own Lord Ganesh has got a lot of symbolism in terms of the weight, and in particular, it has issues in terms of large stomach to peacefully digest all that is good and bad in life. So throughout the history, the way humans have evolved has been that we are living in a situation of depravity as far as calories are concerned. So we are always concerned, when are we going to get the next meal? So our entire evolutionary process has been towards trying to conserve energy and gain fat so that we can survive for a much longer duration. But now suddenly over the last 50 years or so, there has been so much availability of food because of technology and because of processing and so many things, that this benefit that we had to prevent starvation has now gone the other way around. So while earlier गोल मोल बच्चे उनको हम अच्छे मानते थे, now we have a slogan that गोलमोल बच्चे अब नहीं अच्छे. This is a major slogan which Grow India has coined around 10 years ago, and that's why we have to be concerned. Now, why have we got to be concerned is because I'll show this child. This is something which we see now very often in our clinic. 16-year-old boy who has a weight of 127 kg. It's not unusual. And we can see that his BMI is sky high. If you notice, there is blackening in the neck. And this is a very, very common sign. And this sign would suggest that there is an insulin resistance which is happening. This child has a very high risk of developing diabetes right now or in the future. And when we did the workup, we found that he had everything. He had diabetes, he had fatty liver, he had problems related to cholesterol. So this was clearly a scenario in which there were problems in terms of a lot of metabolic complications of obesity is happening, and he's actually a ticking time bomb from that perspective. So before we go ahead in terms of what causes obesity, a brief understanding of what really obesity is. So when we say obesity, we are talking about increased fat and not just increased weight. But when we measure obesity, we usually measure in terms of the weight to height ratio. So body mass index is the way which we do it, and all of us are aware that this is basically calculated using a weight and height, and it's weight per kg and height in meters square. We divide, we get a BMI. There are different cutoffs which are available for the older individuals in India. If your BMI is about 23, that is considered to be overweight, and a BMI over 27 is considered to be obese. But what's important to remember is that children are growing, and for different ages and gender, we have different cutoffs. So when we are defining obesity in children, it's not very easy. It's not just that the child is looking fat to us and we'll say he's obese. We actually have to measure the height, we have to measure the weight, we have to calculate the BMI and plot, and then we can say this child is in an overweight or obese category. Now, the problem with most monitoring programs is, and I'll come back to that later on, in schools also, that we do measure height and weight very commonly, but we are not measuring BMI. We are not interpreting whether the BMI is coming in the obese category, and finally, we're not intervening. So unless and until we're using the data in complexity, in completeness, it's not going to make any benefit to us from that perspective. So this is something which I'll trace out subsequently in that regards. Now, what the world has noticed, and I've told this about subsequently earlier also, that there has been a huge increase in obesity of approximately 20 to 30 folds over the last 30 to 40 years, and there has been a shift in BMI. So there has been a massive increase in obesity. And this is not only seen in the developed countries, but also in India, we are seeing a rapid increase in childhood obesity. It's increased approximately 20 to 30% in terms of prevalence of obesity. This is something which we have to be really worried about from that perspective. This is our own study from around 5,400 school children in Kanpur from 10 different schools. We did this as part of our Road to Growth project. And what we found that there was 36% prevalence of obesity and overweight in school children. So 1 in 3, these were affluent school children for becoming obese or overweight. And this is something which we have to be really, really worried about. What's more important was that as the children became older, from around 10 years of age, they had the maximum increase, particularly in girls. Girls between 12 to 16 years had 36% prevalence of obesity itself. So this is a big problem which we are seeing, and this is going to lead into a lot of complications. One reason which we found on our study was that 80% children were watching television or some screen while eating, which is a known risk factor as far as the obesity is concerned in that regards. So why do we have so much increase in obesity? It's simple mathematics. We are taking much more calorie than we are spending. So now the intake has gone up. The availability of processed food, high calorie food is more, and physical activity, everybody knows, is so much lower. There is a bit of genetic predisposition, but the genes have not changed. The genes we have been carrying on from thousands of years are the same. Then why are that obesity is becoming more? It's more of environment. Now, there may be some familial tendency, but we can't change those. So we have to work mainly in terms of physical activity and intake as well as inactivity. So sitting and just doing nothing is actually bad. And as the old adage goes, that sitting is the new smoking. So if somebody is just sitting in front of the screen, somebody is just studying continuously for hours, that can do a very bad harm as well. So that is another factor which is important to understand in that regards. So what we did was that we actually measured body fat in around 5,000 school children in Kanpur as part of the same study and tried to see what really explained the fat percentage. Remember, we talked about BMI, but here we are talking about more precise assessment of body fat. And what we really found out that if somebody was doing more physical activity and was sleeping more, there was a much better outcome in terms of the body fat. So the reason children are in a way having greater body fat is because they are playing less and they are sleeping less. Every child should sleep at least 8 hours a day. And in our study, we found that more than 60% are sleeping less than 6 hours, especially during school days. So this is something which is a big challenge. Another point which I would also like to bring out is that the body pattern and the circadian rhythm or the daily clock that happens with the children is such that during the adolescent period, when the hormones are more, they would be most active from approximately 10 o'clock onwards. And their sleep will be maximum between 6 to 10. Now, unfortunately, most school timings are very early, so they may not be going in rhythm with the physiological rhythm, and that can be one of the reasons when the circadian rhythm, the daily biological clock, goes haywire. That can also be a cause of disruption in that regard. So, a later onset of school, this has been studied in some of the Western countries, particularly Germany, has been associated with better school performance, better grasping skills, as well as improved lifestyle and reduced obesity. So that is something which may also be considered in that regard. So if we talk about two major factors, if children want to lose fat, simple, of course, calorie intake is one, but increase physical activity and increase sleep. Other things like screen time and other factors are also important. Unfortunately, what has happened is that while we have been going forward in terms of evolution, we are now landing towards obesity problem. And for the first time in US history, since the time it was conceived in 1776, the life expectancy of the subsequent generation is going to be less as compared to the previous one. So all the gains that we have had done through evolution, through thousands of years, all the gain through economics, all the gain through technology is going to be lost if we are unhealthy from that perspective. Now, why are we linking everything to sugar? Sugar is, of course, one of the most important causes of this recent epidemic in terms of obesity. Now, many people actually go to the extent to say that sugar has got everything which takes to define as an addiction or a drug in that regards. Sugar is something that has a tendency that becomes you become habitual to it. If you don't take it, there may be withdrawal symptoms, and in a way it is behaving like a drug. And this was one substance, particularly in India, which was not used at all maybe a few hundred years ago, and now we know that sugar is everywhere, ubiquitous. Sugar is one substance which is not required. If you don't take any sugar at all in a day, you will have no problem. There are so many sources of carbohydrate, simple carbohydrate, complex carbohydrate, from which the glucose can be derived. And sugar is essentially a modern day poison. And I would also agree to the fact that it's more like addiction, and that is causing a huge problem in terms of a burden. So how much sugar should a child be taking? So it's only going to be somewhere around 3 to 5 spoons of sugar, depending upon the ages. So 5 spoons of sugar may sound a lot, but when you compare with what we are taking, you need to understand. A lot of people think that juices are healthy. If you look at one glass of juice, it itself has approximately 6 spoons of sugar. If you talk about a bottle, that would be huge. If you talk about any of these sugary drinks, any of the drink that we take, the cold drink, if you look at the diagram for the Coke, you can see how much sugar is there. So essentially, all these are sugar beverages. And this is something which is doing a big harm. They're not giving you any protein. They're not giving you any minerals, vitamins. It's just sugar, sugar, sugar. And because we get addicted to it, we want to go ahead in terms of taking it more and more, and this process goes up. So if somebody, let's say, takes a juice, one glass of juice, the child has already overshot the total amount of sugar that they should have taken. And often we see children drinking so many cold drinks, and this is not very, very clear that this is going to be a problem in terms of their weight gain and going to have much more calories in that regard. And this is something we need to be really worried about from that perspective. Also remember that many drinks we consider to be healthy, like lassi, that also will have huge amount of sugar. That is also bad. So the best drink, the best beverage clearly is water, and that is something which we should encourage. It's very, very important from many metabolic processes and many other processes from that perspective. Now, many people question that there is a link between sugar and obesity, and I think this graph will really dispel any notion. What you can see, how the sugar intake increased from around 80s. That was a time when a lot of people actually said that fat is bad for the body, and people stopped using fat. Now, if you want to make food tasty, you either add fat or salt into that, or you add sugar. So it was a shift from fat to sugar, and this is the data across the US sugar intake. And you can see it nearly had 3-4 times, and simultaneously obesity increased. Now, thankfully, the sugar intake has come down, and hopefully, we will see a lag which may happen in terms of obesity. But this is not true in our country. The sugar intake is going on continuously, which we have to be really bothered about from that regard. Now, why are we really worried because of obesity? Now, if somebody becomes obese, we have a lot of fat which is there. The body can store only a certain amount of fat in our skin, which is determined at birth. Anything above will go into the liver, causing fatty liver. And this is going to cause a lot of problems, not only in the liver, but also is going to cause insulin resistance. So insulin is not going to work. This is going to cause that blackness of skin, which we saw in that child. And more sinisterly, it will cause diabetes. It is going to cause problems in the girls, period irregularity, hyperandrogenism, heart problems, problems in breathing, problems in bones. So obesity is the root cause of each and every disorder from head to toe. And it has also been shown to clearly decrease the life expectancy, as I discussed in that perspective. So this is our study from the clinic patients. So this is 280 children who came to us with obesity. And what was really, really sad, that approximately 60% of them, these are children 10 to 18 years of age who had some complication. Either they had high blood pressure, high lipids, fatty liver, sugar problem. So 159 out of 282 had more than two problems. So if this is happening between 10 to 18 and they have no symptoms, what is going to happen subsequently is, of course, anybody's guess from that regards. This was another very, very, in a way, intriguing data, which was really warning from that perspective. This is our school study in which we measured blood pressure. And what we found that asymptomatic school children who had no symptoms at all, 1 in 3 who are obese had high blood pressure. So if you have an obese child, he already has a high blood pressure now. So it's not just about diabetes. There are many more problems which are going to happen. So you have to be very, very cautious from that perspective. What also we need to understand is that if a child is obese, most likely he will remain obese through life. If a child is obese at 14, there is a 40% chance of remaining obese. Obese at 16 means 60%, and obese at 18 means 80% chance, and then he is there for life in that perspective. So this is something which is going to track towards the life in that regards. And clearly, if a child is obese, then there is a much higher risk of morbidity and mortality in adulthood. So what we need to understand is that childhood obesity is not just about complications now, it is the foundation of many disorders that are going to happen subsequently in life, and this is something we have to worry. A word about diabetes, which is the major focus here. So what really controls our sugar is that we have a gland called pancreas in the stomach, which produces a protein hormone named insulin, which is pivotal in terms of regulation of blood sugar. So there are two ways in which one can develop diabetes. One, if the insulin is not being produced, which is often more common in children, we label them as type 1 diabetes. As Ms. Anjali was talking about, the child most likely would have been type 1 diabetes. This is a very, very rapidly progressive disorder. If you don't treat it, the child will go unconscious, will develop ketoacidosis, need hospitalization, and they need insulin for life. On the other hand, if the insulin is being formed, but it is not acting, this is the insulin resistance part. This is known as type 2, more common in older individuals, slowly progressive, more common in obese individuals. In around couple of decades ago when I was doing my training, it was unheard of for children and adolescents to have type 2 diabetes. But now, as I show the data, it's becoming more common. And this is something which is going to be a very, very big problem in that regards. So we need to understand that when you talk about diabetes or sugar, type 1 diabetes is an autoimmune disorder. It has nothing to do with lifestyle. It just happened. Like we have thyroid disorder, similarly, this disorder happened. While type 2 is more to do with lifestyle, this is something we can definitely go ahead and prevent. And this is the talk is all about that in that perspective. So type 1 diabetes is an autoimmune phenomena in which the beta cells, the cells in the pancreas which secrete insulin, are damaged. And these children will require insulin for life. This is very important to understand because this is much more common form of childhood diabetes. And CBSE has done a lot of wonderful work in terms of helping these children. We all need to keep aware all the teachers about this condition because it's common. I would have over 1,000 children with type 1 diabetes, and many of them are being helped in school, but many of them they may face problems in that. They need to deal with the disease. They need to take 4 insulins, at least injections every day. They need to be very careful in terms of their nutrition. If they don't take insulin or they become sick, they have a chance of developing emergency, need regular sugar monitoring. And if we do not treat them well, they will develop many complications subsequently. So type 1 diabetes is one thing which we want to sensitize every teacher, every school personnel about because they need to understand the problems of these children. And this is something which is extremely important from that regards. Now, type 2 diabetes, as I said, is basically because of insulin resistance, because of the fatty liver. It's more because of obesity. And this is going to be a bigger problem subsequently because so many children are becoming obese in that regards. Now, what happens that these children, they will develop some alteration in sugars to begin with, but when they follow up on over time, many of them, around one third, will progress to diabetes. And once they develop diabetes, this is our study, which is the first study in India about type 2 diabetes. We had a cohort of approximately 37 children followed up for 3.5 years. What we found that type 2 diabetes in children is much, much more progressive than adults. The need for insulin is much quicker. So children, if they have onset of diabetes, it will be more aggressive, it will have more complications, and they have got whole life to live. Imagine somebody is diagnosed with diabetes at 60 years of age and the complication will take 20 years. So we are okay. We'll say, okay, he has been there, he will have some time to go. But if a child at 15 years of age is developing type 2 diabetes and he develops complications in the next 10 to 15 years, this is going to be really, really problematic because the prime of the life, and if you look at as a nation's perspective, prime of our nation would really be lost because of this type 2 diabetes and a lot of complications involving every organ. So this is something which we need to really avoid and manage in that perspective. And this is something which is very aggressive on that regard. So a lot of work has been done in terms of improving the health. So as part of the Indian Academy of Pediatrics and ISPE, we brought out this childhood obesity guideline. This is more for the pediatrician, but it's also relevant for all the school people. We do say that if you want to prevent obesity, we should have breastfeeding till at least 6 months of age. Very, very important to have regular meal times, including breakfast, and at least 7 to 8 hours of sleep. And these are very, very important from that perspective. So the rule is 5-2-1-0. So 5 fruits a day, reduce screen time, including academic and non-academic, to 2 hours a day, 1 hour of play, and zero intake of sugary drinks. This is something which is clearly very important to highlight, and this can be put up on posters as well to children from that regards. Now, we should also encourage a food plate in which you can distribute is color your plate. You have got all different things, including vegetables, you have cereals, and you have got minimal amount of high calorie scenarios in that regards. And this can then go forward in terms of fruits and various other options which are there. We are developing meal models in which, based upon the height, weight, meal preferences of a child, we can then generate 7-day meal plan. I'll talk a bit about that, which can be quite helpful for school children from that regards. Very importantly is, as we discussed earlier, to have at least 5 fruits a day, some protein fruits as well. So we want to have a combination of both protein, carbohydrate, and fat, and do not have simple sugars in that perspective. And as often is discussed, the body needs maximum energy in the morning, minimum at night time, while we do the opposite. So we should have much bigger breakfast, approximately 35% of the daily requirement, then 30% at lunch, and then maybe 20-25% as dinner is what is recommended. So this pattern also will make us healthy from that perspective. Very importantly, we should also talk about the traffic light approach to children as to what can be taken more frequently so we can have daily intake of regular feel. We always say ki ghar ka khana, dal, chawal, sabji, roti, we don't have any problem with that. The main problem is about the packaged food, the processed food, the drinks, and all those things. And we can then make a frequency chart as well as to when they can have those foods once in a while. And we need to also tell them that if you have one pizza slice, you basically need to walk out for around half an hour to get that calorie burned out. So if you understand that, it becomes easy from that regards. Now, of course, we can talk about food replacement, which products can be better. So if somebody wants to go for, let's say, butter cheese, it's better to go for low fat butter. Somebody wants to go for rice, puri and paratha, we can go to the other options. Somebody wants to have drinks, then best drink, of course, is the water, but you can also think of matcha. So there are options which are available in that perspective, and healthy meals is very important. So most important to have a regular meal. Most school children, unfortunately, do not have enough to eat in the morning, and that really is bad, not only from a physiological perspective, because the body requires a big push at the beginning. Their concentration will be less, and then whenever they are eating, the body will take up whatever is available. So their calorie intake will go more, and they will develop obesity because of that pattern. We also need to talk about how we can reduce the eating out pattern and avoid foods from that perspective. This would be the biggest message. If you take one juice, as I said, you are already exceeding the requirement of sugar for that child for the whole day. And if you talk about one bottle, you're talking about pretty much like a whole week. So this is something we have to be worried about. This is a very interesting one, which shows how much sugar and how much beneficial substances are there. So if you look at the Coke bottle on the right extreme, you can see how much sugar is there. And all these healthy options like the teas and all these juices, they've got huge amount of sugar. The one on the left is the best, that is the water. And if you compare a can of soda and milk, what you can see, the energy that is coming from the can is around 10% of your total daily requirements, while it's giving you zero in terms of any vitamins, any calories, and these things can really be highlighted to identify from that perspective. Physical activity, of course, is very, very important. So we talk about 8 to 10 hours. This is more for younger kids, but at least 8 hours a day. 2 hours of total screen time, 1 hour of activity, and lot of water intake, zero sugary drink. And then we also have a food activity pyramid as to what activities can be done more. And as I said, sitting is the new sleeping. So if a child is sitting down for continuously for hours, we should say, okay, take breaks for 10 minutes, walk around the house and come back. And this is something which often happens in board exams. And we do get a lot of patients coming into us with a lot of obesity, which will happen toward that point in that perspective. So physical activities for at least 60 minutes or more. And of course, we talk about this pyramid as to how that should be from that perspective. We also have to cut down on inactivity and screen times. So definitely 1 hour of non-academic screen time and 2 hour overall is something which is important from that perspective. And sleep, I've already told, is extremely important. And we have seen that obese children have much less sleep, and obesity affects the sleep as well. Sleep is the time when body is recuperating. It is decreasing the stress hormone cortisol. It is increasing the growth hormone. So if somebody wants to become tall, they should have a good sleep. If somebody is not sleeping well, the stress levels will go up because the cortisol levels are high, and that can be a big problem in that perspective. Now, once somebody becomes obese, what we suggest is that we don't want a huge reduction in weight. We want a gradual loss, maybe around half to 1 kg a month. We want gradual changes in those children to prevent further things. Particularly, we don't want them to go down and high, the yo-yo pattern of dieting, which is going to be very, very harmful because every time somebody is losing weight, they are mobilizing fat, which will get deposited in the blood vessels. So if you're going down and up, there will be a huge problem from that perspective. And this is something we wanted to avoid. Having discussed everything and having managed thousands of children with diabetes, what I've realized is that treatment is extremely difficult. So prevention definitely is better than cure. So what measures can we as a society, what measures we as physicians, and what measures we as the educationalists can provide in terms of improving the outcome? So we have to start right away. As I discussed, breastfeeding, we have to promote every child should be exclusively breastfed in the first 6 months. The food choice should be free. We should not be forcing them to eat. We don't force them to complete a particular meal. And very importantly, no television viewing at least till 2 years. This is very clearly been shown to be a reason for increased obesity subsequently. In childhood, school screening programs are a very important thing. And as I said, many schools do measure height and weight. We unfortunately do not translate that in terms of body mass index, how that body mass index fits into the growth chart, whether the child is obese or not, and put a warning in that perspective. Obviously, sleep, which is extremely important here, and physical activity, because they're spending around 8 hours in school, and 1 hour of physical activity, of course, is very, very important from that perspective. In adolescence, and as I said, beyond 10 years, especially girls are becoming more obese, and this has huge impact on their reproductive health. Every day, we are seeing so many girls who come to us with quote unquote ovarian problem, polycystic ovarian syndrome, PCOS. This is all because of obesity. If we do not control obesity, our future is doomed not only from diabetes perspective, but also from the reproductive perspective, because they are going to have huge problems in conceiving subsequently. So we need to reduce screen time, inactivity, and eating out, which is very common in adolescence, is something which we have to take care of from that perspective. So we have talked a lot about what the problem is, the cause of the problem, the possible solution, but how do we go forward? So around 12 years ago, we developed Grow Society, which is Growth and Obesity Workforce. We wanted to focus on common endocrine disorders in children because these were neglected. We worked on growth, on obesity, pubertal disorders, and type 1 diabetes being our main thrust areas. We are conducting annual programs with a lot of huge awareness programs involving all the key stakeholders, including the physicians, including the NGOs, the schools, as well as pediatricians from across the country. We have done a lot of media campaigns focusing on obesity, growth failure, and puberty, and developed multiple resources. So we have got this booklet, which is focusing, whatever I've talked about is largely derived from that, focusing on what should be a healthy pattern for a child from fat to fit. This was our logo. We have developed multiple documentaries and other things as well. Now, one way that we have been always talking about, if we just talk to children that you do this, this is not good for you, it's not the way forward. So what we did was very interesting, was to develop ways in which we can engage school children and develop their own movies in that regard. So this was a wonderful movie which was made a few years ago, and this was on obesity by school children. This was the winner of our film award, and this is something which has been viewed thousands of times over the YouTube, and this really talks about what the problem of obesity from a child's perspective. We have been conducting multiple student awareness programs across Kanpur, including teacher training program and modules in which we focus on 4 sessions on different aspects of pediatric endocrinology. These are the programs I'm talking about. We developed a design workshop with the design department in IIT Kanpur, in which students were trained to design problem solutions for problems, and they were given specific problems for which they created solutions, including some people developed some sort of role play, some developed some booklets, some developed some movies to receive that. The movie making workshop, and a lot of movies were made, and they were trained by the IIT Kanpur design department to how to make movies, and then they developed that in that perspective. So how can we take forward in this direction to improve the outcome? Growth tracking, I think, is very important, because unless we know the severity of the problem, unless the parents are aware, it's just empty talk. They will say, okay, my child is fine, just gol matol hai, khate pite ghar ka hai, there is no problem. So growth tracking and proper monitoring is important. We need to have specified nutritional recommendations which are personalized for that particular child. We need to have regular pattern of exercise, which of course CBSE has taken a big lead in that direction. And of course, we need to ensure healthy sleep from that regards. The problem that we have is that while height is being measured, as I said, it's not properly being interpreted. So the data which we are not interpreting is of no use from that regards. There are no clear-cut recommendations as to what a child should eat when, what sort of meal pattern will help them, what is the variety of meal pattern, what will be healthy. Exercise opportunities beyond the normal schools, of course, is limited. And often children are overworked. There's so many competitions going on, so many projects going on. And the first thing which is being affected is definitely sleep. And this is, I said, exercise and sleep are the major predictors of body fat in our study from that regards. So we have tried to develop a novel tool in the form of a personalized, intelligent care called MediHealth, which we have nearly developed now. We want to implement that, which will, based upon the basic inputs that the parents will put in, it will give a whole 1 week meal plan as well as look at in terms of the individual whether child is obese, normal, underweight, and then go forward. This will be associated with our app, which will allow growth tracking, screen monitoring, play recommendations, sleep recommendations, nutritional recommendations, and information from that perspective. So I think the main message that I would like to give from this perspective is that obesity is a ticking time bomb. If the time bomb has already not ticked, it's going to tick up in the near future. But diabetes in children is a real problem. We are facing it, and this is much more difficult than diabetes in adults. If we want to do something, we have to work at prevention level. And the best modality to prevent will be the schools, which will have the best opportunity to interact with children. They can act as a conduit of this message that we, as pediatric endocrinologists, pediatricians, doctors, want to give to the parents. And this is something I think schools have a huge responsibility and a huge role to play in this regards. Once again, I have to thank Dr. Balvinder, Ms. Shobha, and Ms. Anjali for providing me this opportunity to interact on this topic. And hopefully, I have been able to sensitize a few issues from that regards.
Yeah, thank you very much, sir. It is an eye-opening session, and we have learned a lot, especially sir has stressed upon right eating and proper sleeping and playing in the ground. That is the three major areas which we need to work. Apart from that, sir has given us two codes, 5532 codes for eating and 10 to 10 for the physical activity. I think these codes will be very helpful to educate the children and the teachers. And if we display these codes in the school somewhere on the sugar boards, it will be very easy to understand for everyone. So thank you very much, Dr. Anurag Bajpai, sir, for sharing your valuable insights on type 2 diabetes among children. So your expert talk has provided us with a deeper understanding of the causes, consequences, and practical strategies for prevention and management. And whatever you have, guided us and recommended us, I think we need more sessions on this and a serious study also. All the principals and teachers, they need to devote some time on this serious issue to understand it. So more sessions are required, more reading are required, and we can utilize the app which has been developed by the Grow India Society. That app will also be helpful to everyone for understanding and controlling and calculating the data, taking the data for this control of type 2 diabetes. Thank you very much, sir, for your insight and valuable guidance.